Welcome everyone, this is Dr. Robert Zaid. I'm going to start the presentation. This will be recorded, so if anybody wants to at a later time review it, they'll be able to. This is different for me because I'm used to talking in person, so I don't have the ability to see cues from the audience or to be able to see if people laugh at my jokes. So if you think I'm funny, you're able to respond on Facebook, and if you don't, you can tell me later. All right, so let me begin. Thank you for joining us tonight. If anybody has ideas, I don't mind doing this if it's a popular thing to present once a month on different topics. You can suggest them in the comment box, and we can figure out if that's something that people would enjoy. It would be fitting for me to do an aviation exam or aviation presentation and to talk about travel. And so planes can take us all over the world. They can take us to places in our dreams. And as an aviation medical examiner, we want to make sure that you're able to do that safely. Part of our job is to make sure that we plan ahead. This was taken in Italy. I was at a wedding for one of my nieces, and my job was to drive people back and forth to the wedding. I enjoyed it. I had my Italian music on. It was a lot of fun. But when you have the one-way road, you have to know when to go on to the side, when to let people go. And even with the best preparation, I didn't really know how to handle the rain. And so we really want to try to keep you out of the ditch. As an aviation medical examiner, that's our goal, is to make sure that you're doing things safely. So before I begin, I need to let you guys know that even though I'm appointed by the FAA, I do not represent the FAA, so the presentation is informative and created to educate pilots. It was created by me and not the Federal Aviation Association. So I like to give a little outline whenever I do a presentation. And real quickly, some of the things I'm going to talk about tonight is, the goals of aviation medical exam. There's a section for student pilots, some topics in there. I want to really dive into the AME guide and then talk about some things that we're doing in terms of virtual consultations, and then leave an open forum. I usually do these informal, and when I'm live, I'm able to stop and answer questions. If I see a question in the comment box, I'll be happy to try to answer that if I have time. All right, so what is the goal of the aviation medical exam? It's all about safety. Over the years, the FAA has studied all kinds of medications, medical conditions, and we found a way to keep the airways safe by creating a network of AMEs. Basically, with all of these studies, they've developed protocols on how to fly safely with different medical conditions. And what I go through tonight, I want to let you guys know, there's no secret to it. A lot of the stuff is published online. I want to show you how to take advantage of resources that are available to you to make sure that you prepare, because preparation is key for these exams. If you come into your AME and you've got all your paperwork ahead of time, your chance of deferral goes way down. In fact, I got frustrated over the years where people would come in and they would need a simple letter from their primary doctor, and I'd have to send them back only to waste their time. So hopefully this will help some people reduce deferrals. And then the other purpose I want to make sure that I take away the fear of the aviation medical exam. 99.9% of applications are approved by the FAA. Sometimes they take more time, but almost everybody gets approved. You just got to work through the process. Every year, more protocols, dispositions, flowcharts, and pathways for getting a license are approved by the FAA. When I first started, there were strong restrictions against diabetes and vision standards, and a lot of those things have evolved over time. You can now fly with insulin, which was not something you could do back in the day. I have this question, I usually do it during live events. Can you fly with one eye? The answer is yes, but you have to do a statement of demonstrated ability, a SOTA. And that just requires somebody going up and making sure that you can do that safely. So there's lots of ways to fly even if you have disability. All right, so I'm going to move on. We talked about purpose of the FAA exam. You know, the FAA was established because at one point there were a lot of crashes and they were trying to find a way to minimize that. One of those ways is to make sure that the pilots flying the planes were healthy. And then there's a lot of other regulation that goes into that as well in terms of testing and aptitude. The medical exam solely is to make sure that when a pilot comes in, is there anything that we need to do to optimize to make sure that the pilot is safe to fly? And in most cases, pilots are safe to fly. Sometimes it needs extra work. So just a quick overview. I'm sure many of you guys know this. First class, there's 3 different classes of medical certificates, first, second, and third class. If you're getting a first class, that's because you want to fly for the airlines. You're an airline transport pilot. Typically, a second class is for somebody who's a commercial pilot. Maybe you're flying, taking cargo, or air traffic control. Something that doesn't require you transporting people. And then commercially transferring people. And then third class is for private pilots and recreational pilot. Each one of these has a different duration, and whether you're older or less than 40, it makes a difference. So a first class will last 12 months under 40 and 6 months over 40. Second class is 60 months under 40 and 12 months over 40. And a third class is 60 months under 40 and 24 months over 40. Can you guys hear me okay? If there's any issues with audio or visual, please send a message in the chat box. All right, so a lot of people ask, well, I got my second class. Would I have received my first class? And most of the time, there's not much difference, right? You know, the big difference between a first class, second, and a third is that the first class needs an EKG. The vision standards change a little bit for the first class, and there's a lot more strict guidelines. So if you have diabetes, heart disease, cancer, the first class might be a little bit more rigorous to get that approved, but in general, get the class that you need for your job, and if you're unsure if you can obtain one of those and you're worried about a medical condition, just talk to your AME ahead of your exam. Once you open up the application on MedExpress, we have 14 days to submit it to the FAA. And if there's preparation or work that needs to be done ahead of time, and we don't get that information back in 14 days, we have to then send it to the FAA, which creates a 60-day window, and that could put you at 74 days before a decision is made. So we really like to prepare ahead of opening up that application. That's a really important point. All right. So there's a lot of topics I could talk about. I'm not going to talk about a lot of these tonight. I'll just kind of glaze through them, but I'd like you guys to let me know if you want me to bring it up, as a full topic. Sleep apnea is a big topic, both with FAA and DOT. Sleep apnea occurs 2 different ways. It can be from central sleep apnea, which comes from the brain, or it can come from a mechanical sleep apnea, which usually comes from the neck or the airway. If you obstruct when you're sleeping, some people with sleep apnea might not get a full night's rest, and they might actually wake up sometimes, 30, 40, 100 times an hour, and it creates daytime somnolence or tiredness, which, as you could imagine, isn't really safe for flying. And so the best way to keep your job is not to get sleep apnea. If you do get sleep apnea, it's not a problem. You do have to be treated properly and show compliance with it. There's a process to make sure that you're doing okay with it. Again, it's better to treat these things and show that you're doing well than to have it and not treat it. But I always tell my pilots, especially my student pilots, that this is the only career tied to your health. And so it's really important to make sure that in your lifetime you focus on nutrition, exercise, things that can help you live longer. Because outside of just flying, it's important for quality of life. If you can fly, that means you've got pretty good resources. I want to see you guys living bonus decades and enjoying time with your kids. I put ADHD and depression on here because those are topics that have come up recently. The FAA has created protocols to help people who were previously diagnosed with ADHD get their certificate if they follow certain rules. So they're open to it. You still really can't fly on a stimulant, but if you've got questions about that, talk to your AME. Depression, I kind of really like the fact that they've opened up to allowing pilots with depression flying, because treating depression, is always better than not treating it. And I always worried that if you couldn't fly with depression, if pilots decided not to treat that, that could be more problematic. All right, I'm going to move on. So these are things that you can find on the web. If the FAA did not want pilots to see this stuff, I would imagine it would be password protected and only for aviation medical examiners. But I'll show you what we look at. And there's lots of ways to get the information. Sometimes a Google search works. The FAA divides their AME guide into disposition tables and disease protocols. In my mind, those are kind of like the same things. But I want to show you an example of like what we look at when we try to decide if a pilot is safe to fly. So a disposition table, I picked from this list neurology just to show you guys. When you click on neurology, you can see a list of different conditions, and I only show you A through C. It actually spans much further down. But let's say we picked up concussion, right? So I had actually a student pilot who came in who was 17 years old. He had a concussion when he played football about 5 years ago. Actually, no, it was 3 years ago. And he was perfectly fine. I was talking to him. If I was following, when you follow this protocol, if the applicant didn't have a concussion, didn't have brain injury, and followed all this criteria, that far right column that says disposition and marked green says I can issue that. I just have to write down some comments in box 60. Well, this pilot falls into a category that's 3 levels down, that was less than 5 years, and he had a concussion. But I knew the pilot was good, so I called my regional flight surgeon and said, hey, I've got this pilot in front of me. I fly with him. He had concussion during football. He's perfectly fine. They said, no problem, give him the certificate, and I was able to give the pilot the certificate instead of deferring. And so even though the disposition table sometimes can point you in a direction that may take more time to get things done, there are ways for your AME to fight on your behalf. So anybody know what a CACI means? This is, again, one of those things that's better done live, but I always thought these acronyms are kind of funny. Conditions and AME can initiate, right? So, all right. There's about 20 CACIs that we can work with, and I want to show you an example. These are common things, right? Somebody's got arthritis, they've got asthma, they've got blood pressure, they had prostate cancer. This is a way for us to kind of get a certificate for an airman if they follow certain criteria without having to defer them as long as we have the information. And I want to show you like an example of like asthma. So if you look, and I clicked on asthma, it tells me, it's pretty straightforward, that if they have mild or seasonal asthmatic symptoms, then I'm able to pull up a khaki asthma worksheet, and as long as the airman meets all the criteria, I can issue it. Now, if they don't have everything for that khaki asthma worksheet, it'd be real easy for me to defer it, but again, that puts a potential 60-day delay on the application. So here's what a khaki looks like. This is the asthma one. This is really important, and this is where the preparation and a consultation can be really helpful. At the very top, it says, AME must review a current detailed clinical progress note generated from a clinic visit with a treating physician or specialist no more than 90 days prior to the exam. And then, of course, the treating physician has to say it's stable. They got to say that the symptoms are less than 2 times per week, that the applicant or pilot is on one or more of the following medications, and if it's only, once in a while, then they don't need this PFT test, the additional testing. The instructions are right here. So if the pilot came in with that letter, that's easy on day one. If they had questions about the letter, talk to me before they come in, or talk to your AME before they come in so that we can make sure that they have that information. Now, if I know the pilot has asthma, I don't open up the application until we talk about it ahead of time, because I don't want that 14-day time clock to start. So what I would like to do is, if a pilot knows that they have a khaki, and they can go and see their doctor ahead of time and bring that information, then on the day of the exam, I can say check, 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 and I write in the box khaki approved for asthma, khaki qualified for asthma, and I'm able to get that pilot a certificate. These are avenues that we're given as long as we have the information. Now, sometimes a pilot might be frustrated with asthma, that they're in the room and they don't get their certificate, but it's much easier to go this route than to defer to Oklahoma. So disease protocols are higher on the tree from disposition tables. There might be more information included with them. And like an example is ADHD. So with ADHD in the disease protocols, they give you a lot of different options depending on where you fit in the paradigm. And I'll just show you, basically for ADHD, the trigger is 4 years. So if you haven't had symptoms in 4 years and no medications, you can do a fast track. If it's less than 4 years, you do a standard track. The disease protocol helps us guide that with the pilot. All right. Any questions? Put them in the comment box. I'm used to Zoom where we can have a conversation, but I can't even tell my jokes, and that's okay. So, because I can't hear you guys laugh. I'm going to move on here. This is just more of the ADHD fast track. So whenever I talk to a pilot for the first time, maybe even the second time, I always ask them, anytime you're given a medication or you want to take a medication, always ask one question: is this safe to fly with? And if you don't know the answer, try to look it up or talk to your AME. So even things like allergy medicines that are over the counter that you might think are benign might have a wait time where you're not supposed to fly for 5 half-lives after it. So you want to make sure, again, this is all about safety, that you're not doing something that could affect your safety. Because you might get up in a plane if you didn't tell somebody, but you know what? If you caused a crash, that's not good for anybody. So again, it's all about safety, right? So there is something called do not fly versus do not issue meds. Do not fly medications are, like I was talking about, allergy meds or something that might have a wait time. Do not issue meds are medications that are not compatible with being safe and flying. So you need to, I've had probably 5 people in the past month that were on do not issue medications, and I knew there were alternatives that they could fly with. So what I did was, before opening up their application, I gave them a list of approved medications, asked them to go to their doctor, see if they could switch it, and then when they came back, I was able to certify that they were no longer on those medications, and they no longer had a risk to safety by being on those medications. There's a little bit more we have to do with that, but that's important to know with your medications. I do have a question in here, some insight. Okay. With respect to do not fly medications, are you able to provide some insight into HIMSS SSRI program? For example, if someone is currently prescribed to SSRI, but when taken together, is their path forward? So I am going to respond to you separately, Terrence. There are pathways for flying with SSRIs. I am not a HIMSS. I've got great HIMSS that I work with. I am applying to be a HIMSS. You have to be senior for so many years, and there needs to be a need. But I will, if you put your email, or if you email me, Terrence, I will get you an answer for your question. Thank you. All right. So now, the other thing that the FAA does is what's called a special issuance. There's about 30 different conditions that can be approved for special issuance, but the FAA wants to see documentation before they approve it. Once they approve it, they will allow us to do a time-limited certificate for these conditions, and then you have to provide certain documentation and updates to the medical condition. And then I have some tips in general for pilots. I would establish with an AME that can get to know you and fight for you. Prepare for the exam and set up early in the month it is due. Prepare paperwork, wait times before starting the exam. Initiate a consultation prior to your exam. If you are not sure if your condition will require extra prep, bring your documentation with you. Bring more than you think you need. People are afraid of documentation hurting them, but again, there's a process for everything. You could fly after blood clots, but you got to make sure that it's stable and you're doing the right things. Bring your glasses and contacts. I could tell you how many times people came in, they wear contacts or glasses, they forgot to bring them in, and they didn't pass the vision exam. That doesn't help. You can fly with glasses and contacts. And then don't consume stimulants before an exam. I do not want you to have high blood pressure when you're in my presence. If you have high blood pressure, treat it, be stable, come in once you're stable, and then be honest. The worst thing you could do is not put something on your application that later on the FAA finds out. It is a hassle to work through that, and it becomes a legal issue, so do not do that. And then one thing our office is doing is we're providing virtual consultations, so if that is something that you would find of value. We do charge for them, not as much as FAA exam, it's not bad, but we can do virtual examinations or virtual consultations, not examinations, for any pilot that wants to talk about what prep work they need before they come in for their live exam. And then I wanted to open it up to questions if anybody has questions. And for anybody that watches this at Michigan Pilots, I do want to be a resource for you guys. I normally charge for virtual consultations, but anybody that's listening to this or anybody that is in the Michigan Pilot group that emails me the next day or two, I will be happy to answer questions for them. So please get the word out. I definitely want to be a resource for you guys. And then here's my contact information. I also put my email in the chat box. You know, I am new to Facebook Live. Hopefully that was good. But I'm around. If you guys need anything, let me know. And again, if there's anybody that any topics that you guys want me to present on, I will be happy to do so. So I'll stay on for a few more minutes. You know, if anybody has questions, they can put it in the chat box. All right, thank you very much. I'll give, actually there's 5 people still on, so I'm going to give a few minutes if anybody's got a question. Let me just refresh my screen, make sure there's no questions in the chat box. I wish this had the ability to hear people live, and I don't know how to do a Zoom. That would be really hard in this group, so it is what it is. All right, let's see. Okay. Very good. Thank you guys again. If you have questions later, just send me a message. You've got my email.